Today we're going to talk about menstruation. This is part 2 in a women's health series that we've been doing. We're going to talk about the basics of periods or menstruation. We'll cover a wide variety of things, including what periods are, why women have them, when they start, when they stop, what to do when you have a period, what a normal period is, what to do if you have painful periods, what to do if you have mood swings with your periods, when to see a doctor. Most people know that females menstruate, but why is that? What causes females to menstruate and men not to menstruate? Now, in the last video, we already talked about the female anatomy. So now that you have that knowledge, let's build on that to understand why women menstruate. Once a woman goes through puberty, they start releasing an egg every single month. In preparation for that egg release, the body starts preparing for a pregnancy, because with every egg, there's the potential of having a baby. The way that the body does that is it starts forming a lining on the inside of the uterus or the womb. Just in case you've forgotten what those parts are, so here are the ovaries and here is the uterus. And every month, as the ovaries are getting ready to release eggs, the lining of the uterus starts to thicken. What happens is that if an egg and a sperm meet and form an embryo, that embryo wants to implant into the lining of the uterus. This lining is full of extra tissue and blood vessels, and it forms a source of nutrition for the growing baby, or basically the source of the food for the baby. If a woman doesn't become pregnant, then this lining is shed, and that's what's called menstruation. The reason that it happens every month is an egg is released every month, and the sign of not being pregnant is that you have your period. So now that we know what periods are and why they happen, let's talk about what normal periods are. How long are periods supposed to last? So periods can last for varying amounts of time. So two people in the same family may have different lengths of how long their blood flow occurs, as well as how far apart their period dates are. So normal periods, in terms of the blood flow, can last anywhere between 2 to 7 days. Usually the period is heavier in the beginning and then it lightens up. I mentioned that an egg is released once a month, but that's not completely true. Even though a month has anywhere between 28 and 31 days, the time difference between your periods can be shorter or longer than that. Normal periods can occur anywhere between 21 and 35 days. It just depends on you and your body. So if you're having periods every 14 days, that is something that you need to see your doctor for. And if you're having periods every 37 days, that's something you need to see your doctor for. But if they're between 21 and 35 days and they're consistent for you, then that is not something that you need to worry about generally. Let's do a little quiz to make sure you understood what I was talking about. So here's a calendar. And so I'm going to give you 2 dates, and you will have a chance to decide if that is normal or not. So first of all, let's start off with how many days your period lasts. Let's say your period started on the 1st and it ended on the 9th. Would that be a normal period? Or is that something you need to see your doctor about? If you look at the dates from 1 to 9, that's actually 9 days that the period has lasted. 1, 2, 3, 4, 5, 6, 7, 8, 9 days. And so that is more than the 2 to 7 days, and you should go see your doctor. Let's try a couple more just to make sure we got this. So let's say that your period starts on the 3rd and it ends on the 9th. Is that normal or not? Let's count it out. 1, 2, 3, 4, 5, 6, 7. So 2 to 7 days is normal, so that is normal. Now let's try one more. What if your period starts on the 17th and ends that same day? What would you consider that? That would be a 1-day period, and that would be something that you would need to see your doctor for, because it's outside of the normal range of 2 to 7 days. Now let's talk about the timing between periods. And for this, I know you'll need potentially 2 calendars, but let's go ahead and just start with the first one. say your period started on the 1st and then you had a period on the 15th. Is that normal or not? If you count it out, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, you see that that is 15 days. What was the normal length between periods? It's supposed to be 21 to 35 days. So in this case, that would be something that you would need to see your doctor for. Now let's look at another scenario. What if your period started on the 2nd and the next one started on the 30th? How about that? So you can go ahead and count those days as well. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29. So that's 29 days. Does that fall in the range? Yes, it does. So that is a completely normal period. Now let's look at another case. So here are 2 calendars. So on the first one, I'm gonna say that your period started on the 1st, and the next time that it happened was on the 3rd of the month. So if you count that out, you'll see that there's 31 days in this month. And then if we count out 32, 33, 34. So does that fall in the normal range? Yes, it does, because it's within 35 days. Now, one last one. Okay, so just to make it easy again, we'll start off on the 1st, and let's have our next period happen on the 7th. So is that normal? So if we take the 31 days of the first calendar and we do 7 more days to that, right? So 32, 33, 34, 35, 36, 37, 38. So 38 days is more than 35. That's something you need to see your doctor for. So I hope that makes sense. You want your periods to last 2 to 7 days. Anything outside of that, you want to go see your doctor, and you should expect that the beginning of the bleeding times is heavier for a couple of days, usually for most people, and then it gets lighter. And the timing between 2 periods should be somewhere between 21 and 35 days. Anything outside of that, you definitely want to go see a doctor. Now that said, those are the dates when you initially start to have periods. Your body's still adjusting to all the changes in hormone levels and things like that, and it takes a little while. So children, when they first start having their period for the first couple of years, may have periods that last longer, even 45 days, and that can be completely normal. So we've been talking about menstruation and how the blood flows for 2 to 7 days. What do you do with all that blood? So there are many different products out there that you can use to absorb that blood, and so it doesn't flow out onto your clothing. So one of those are menstrual pads. Some of them come with wings so that your underwear doesn't get stained. Another product is called a tampon. Pads are something that you put on top of your underwear, and then as the blood comes out of your vagina, the pad soaks that blood into the pad itself. And when it's full, you can change it. Even if it's not full, I would recommend changing it at least once or twice a day. In terms of a tampon is actually something you insert into the vagina, and it has a string that is left hanging that allows you to be able to pull it out when it's time to take it out. Now, some people get concerned that if they're inserting something into their vagina, then maybe they won't be a virgin anymore, or it'll create problems. But a tampon is small enough that it will not injure your vagina or injure your hymen. Many women like using tampons because it allows them to swim and do other activities, and there's not a bulky pad in your underwear. However, there are some risks associated with using a tampon. And so there's some things that you should keep in mind. One is always use a tampon that's needed for the level of bleeding that you're having. Both tampons and pads actually come in different absorbency levels. So some are for heavier bleeding and some are for lighter bleeding. If you are using a tampon, you need to use the tampon that goes along with the bleeding level that you're having. So if you're having light bleeding, you should use a tampon that's for light absorbency. Whereas if you're having heavy bleeding, then use it for heavy absorbency. You want to change your tampon every 4 to 8 hours. You can consider switching between tampons and pads, even in the same menstrual cycle if you want. You don't want to use tampons for anything other than menstrual discharge or the bleeding. You don't want to use it for any other vaginal discharge. And lastly, you want to know the signs of toxic shock syndrome, which is the problem that can occur with tampon use. So what is toxic shock syndrome? It's something that's actually life-threatening, and so it's very important to know what the signs and symptoms are so that if those start to occur, you can go to the emergency room and be treated. These include a sudden high fever, such as a fever over 102 degrees Fahrenheit, muscle aches, diarrhea, vomiting, dizziness or fainting, a sunburn-like rash, a sore throat, and bloodshot eyes or red eyes. If any of those symptoms occur while you're using a tampon or shortly after you used your tampon, you should go see your doctor. When you start and stop having periods, menarche, or when girls start having periods, occurs in a range of ages, generally between 10 and 15 years old, with the average being 12 years old. Usually people will have their first period within 2 years of starting to develop breasts. The beginning periods can be short, they can be a brown discharge, there can be a wide gap between when one period occurs and another, and that can all be normal. Women usually go through menopause or stop having periods around the age of 50. Usually periods get shorter and shorter and shorter until they stop completely. If you've gone for 1 year without having a period, you're officially considered to be in menopause, or that your periods have stopped. This means that you are no longer able to have children. If, of course, you have periods after a period of 1 year of not having periods, you should see a doctor. Some people have painful periods. What can you do for that? A heating pad is often a good thing to use. You can get a heating pad and just put it over the bottom of your belly. Taking a warm bath can be helpful. Taking medicines such as ibuprofen or naproxen, Advil, Aleve in the doses recommended on the bottles, or if you're living in a third world country and have no kidney problems and no reason that you can't have these medications, ibuprofen for 200 to 800 milligrams 3 times a day with 8 glasses of water throughout the day and food, or you can take naproxen 250 to 500 milligrams twice a day, again with the same stipulations. It's always good to check with your doctor first to see what they recommend though. Sometimes you can have some medical issues that cause you not to be able to take those medications safely. If you have painful periods every month, something that can be helpful is tracking when your period's going to happen. Like if you know that your periods happen every 31 days, you can mark that out on a calendar, and when you know that your period is about to happen and your pain starts the same day or the day before, then you can start taking the medicine before that happens. So if your pain's going to start the first day of your period, you can go ahead and start taking the medication right in the morning of the day that your period is going to start, or the day before. And if that works, you can continue doing that. And if that doesn't, obviously, don't keep doing that. And then you can always try a month off to see if you still need to take the medication regularly. You can also talk to your doctor. There's other medications that they can prescribe for you to help with that pain. Now, some people have mood changes associated with their periods. So what do you do about that? These mood changes start sometimes 2 weeks before the period begins and can last until the period stops. So there's some easy lifestyle changes that you can make. 1 is getting 8 hours of sleep a day. 2, exercising every day for 30 minutes. 3, eating good and healthy foods such as fruits and vegetables. 4, avoiding unhealthy foods, sugary foods, salty foods, alcohol, and caffeine. 5, finding healthy ways to deal with stress, such as going for a walk, exercising, yoga, meditation, talking to a friend, massage, journaling, relaxation therapy. 6, don't smoke. 7, there's certain medications that can be helpful. Sometimes ibuprofen, like we talked about before, can help with some of your symptoms if you've got some pain associated with it. Some people find taking some vitamins and minerals can be helpful. You can talk to your doctor about that, but just taking a multivitamin might be helpful if you aren't getting enough in your daily diet If these methods don't work, it's always a good idea to always just see your doctor. They can actually prescribe you different medications such as birth control pills that can help control your mood swings, as well as medications called SSRIs, and they can help stabilize your mood as well. Now, we've been talking a lot about periods, and I've been throwing in when you should see your doctor, but let's just go over a more comprehensive list in one place. Obviously, there are other reasons to see a doctor as well, but here are some things that you should see a doctor for. Number one, if you're 15 and still haven't had a period, please go see your doctor to make sure everything is okay. Number two, if you have not started having periods and it's been 3 years since you first started developing breasts, or you're 13 and you still haven't started developing breasts. 3, you stop having periods for more than 90 days. 4, your periods become irregular after they've been regular for a while. 5, if your periods don't fall in the window of occurring every 21 to 35 days. So if they're happening more often than 21 days or less often than 35 days apart. 6, if your periods last for longer than 7 days. 7, if you're bleeding more heavily than usual or you're using more than one pad or tampon every 1 to 2 hours. 8, if you're bleeding in between periods. 9, if you have severe pain associated with your periods. 10, if you suddenly have a fever or start feeling sick after using tampons. I hope that helps answer most of your questions on menstruation. Feel free to reach out if you have any more, and watch the rest of our women's health and other health and safety videos that save each one.